Welcome back to Your Carolina. I have sitting with me Dr. Daniel Nickles. You're kind of a superstar. We see you on TV commercials all of the time, and some folks might be your patients out there, and you really are a superstar probably to them.
Try to be.
When you can make a person smile, yes. Whether it's as simple as giving them flowers or actually changing their mouth so they feel comfortable smiling, you mean a lot to them, I bet.
We change their life.
Yeah.
We surely do.
Well, you've brought a lot of things here we're going to talk about in just a second. We've been hearing you talk a lot about No Fear Dentistry in those television commercials.
Right.
And that really is, I think, the foundation.
You know, dentistry has made so many leaps and bounds in the way we've changed dentistry, and especially with the technology. And that's one thing I strive myself on, is being up to date on the latest proven technology. And, you know, part of that is things are getting where, you know, it doesn't have to hurt to go to the dentist anymore. So many people have been hurt, and there is that true fear of, you know, just trying to even get through the door. So we do a lot of sedation dentistry. I mean, I sedate every day, and it helps people to come in to, you know, overcome the fear of, you know, I'm going to go to sleep and I'm going to wake up with that beautiful smile. I can have, you know, 5 or 6 appointments done in one sitting, and it makes it easier for them to come in, get what they do need, and, you know, not walk around embarrassed, not walk around in pain.
And it eliminates the anxiety, because there are some people, and if you're not one of those people who don't get anxious, nervous, physically, I mean, ill at the thought of going into a dentist, there are those out there who do.
There are people who, I mean, they are physically, I mean, they will get physically ill. I mean, I have seen them walk up and back from the door. I've had people come and sit in the waiting room and leave. And they'll come back in, and it's a sad thing, and it's something I noticed early on in my career, that, you know, I'm doing a lot of extractions, and I'm talking to these people and said, you know, what got in the way?
Why did you wait this long?
And, you know, I went, I got hurt, I never went back. And I'm going, well, can you blame them? I mean, if you have that one bad experience, you keep going back for that, and so they have been so hurt they just can't, you know, get up the nerve to go back
Well,
again.
I'll tell you another thing that probably kind of gives people a bad feeling, or maybe discourages them from completing a dental process, and that is, you get something done somewhere, and then they say, okay, so we're going to make an appointment with so-and-so, you know, next, and they send you to some other guy, and then that guy sends you to the guy who makes the moles over here. One stop.
One stop. Yeah, that's what I want for my patients. They come and see me.
Right.
They have total access to me. All my patients have my personal cell phone number. They come to me, and I take care of everything. Especially if you're sedated and you're trusting me to take care of you, and I'm in the middle of a process, and all of a sudden, let's say, you know what, the decay is deep, you need a root canal. I'm going to wake you up and go, hey, I want you to go across town next month and see Dr. So-and-so.
No.
You know, you're going to have that tooth extracted one day because you're never going to come back.
Sure.
So, you know, we take care of everybody. We take care of every specialty, other than ortho. But, you know, if something you really need right then and there, we have you covered in my office.
Okay. Now let's talk about your show and tells.
My show and tells.
And I instantly think about, I was talking earlier about, you know, when I was a child, drinking those Czech colas, you know.
Yeah.
Well, also as a child, I remember looking at those, you know, denture commercials. Where they, you know, would
the
put,
denture cream.
It looked like toothpaste. They'd slow, and they'd talk about floppy dentures. And is that day and time gone?
That is past gone. The standard of care is not a lower denture anymore. The standard of care is a lower denture with 2 implants minimum, because you know, think about, you know, we have these nice set of teeth, and then something were to happen, accident, you know, you had a bad experience, you never went back, and I'm going to make you something that flops around in your mouth, and that doesn't make sense.
So if anyone out there is experiencing the actual teeth, what they eat with flopping around, they should not be, and
they
you can
should
fix
not
that.
be. I can fix that.
Okay. We're going to bring you back next week, next Friday, to answer some viewer questions.
Okay.
So at this time, I want to let you all know, go ahead and be sending those in, or certainly join us next Friday with your question, and you'll be on hand just to answer viewer questions next week. Where can they get in touch with you if they have a dental emergency? They can't wait till next week.
Okay. Give us a call at the office, 244-3211, and they can also find us on Facebook at Greenville SC Dentist.
All right.
So.
Well, you know what makes me smile? A pretty dress. Yes, Dan, the cameraman, that's your cue. Take a look at this beautiful dress over here. Demetra Design coming up on the show. We'll look at some really pretty stuff. Plus, we'll also be checking out your answers to our question of the day, so keep those coming on our Facebook page. And of course, Greer Flooring Center, if you'd like to improve your flooring as much as that beautiful smile of yours. Well, then check out my friends at Greer Flooring. 331-3000, been serving this area, have a great reputation. I've been talking about them for some 15 years. Greer Flooring Center, serving Spartanburg, Greenville, and beyond. Go in and see them. Tell them Kimberly said hi. We'll be right back.